Good evening. My name is Dawin Sichimba. I'm the president of the Association of East African Neurosurgeons. Today we are happy to have this meeting, this presentation. But today actually we have a special feature by Access Bank, Cameroon. It's a pleasure to have them. So before we get into today's presentation, we're first going to have a presentation from Access Bank. So before we get into that as well, I'm going to ask everyone to introduce themselves, and then I'm going to officially introduce the representatives from Access Bank. Then we proceed with their presentation. So I'm going to ask Bejo, you can introduce yourself.
Thank you very much, Darwin. I'm Takutin Dogmo Bejo, final year medical student at the University of Boya in Cameroon, and the operations director of the Association of Future African Neurosurgeons. Happy to be here with you guys.
Thank you, Bejo. I'm going to ask Dr. Zolo. Please, you can introduce yourself.
Hello, everyone. I'm Ivan Zolo. I'm a physician, and I'm a global surgery fellow at the University of Cape Town in South Africa. Happy to be here.
Thank you so much for being here. David, right? David might not be available. I think he talked to us earlier. Daniel Musonga. Sorry for pronouncing your name wrongly. This is Daniel Masunga. Okay, I hope I pronounced it correctly. Okay. We also have Lauren. Lauren, please introduce yourself.
Hi, hello everyone. My name is Lorenzo Appella, and I'm a fourth year medical student at the University of Botswana and also the Vice President of AFAN, External Affairs. Thank you for having me.
Thank you so much, Lauren, for being here. Then we also have Wapres.
Good evening, everyone. I'm Wapres, a CDM medical student from Cameroon. I'm also the AFAN country representative for Cameroon. It's a pleasure to be here.
Thank you. Thank you, Wapres. Then we also have Sakanya.
Hello everyone, my name is Musakanya Shturuka, a final year medical student from Zambia and also AFAN's country representative in Zambia. I'm glad to be here.
Thank you. Okay, then we also, I'm trying to look out the name so that I don't call the special guests to introduce themselves before we introduce them officially. Then we also have Rodrigue.
Yeah, thank you. I am Rodrigue Ndawashinze, medical student, last year medical student from University of Burundi. I am a AFAN country representative in my country, Burundi. Yeah, thank you.
Thank you, Rodrigue. Then we have Tabo.
Well, I'm Tabo Mwati. I'm a first year medical student in the University of Lusaka, here in Zambia.
Thank you, Tabo. All right. Then we also have Ivy. Okay. So I'm going to go straight and introduce the special guests, and then I'll allow them to go ahead with the presentation. So today, our special guests, we have Access Bank from Cameroon. They're here to tell us about the bank and the services that they offer. Of course, they're going to explain in details what they want to talk to us about. But in brief, that is it. So we have with us the Relations Officer for Corporate Banking. That is Mr. Terence. Mr. Terence is here with us. Then we also have the head of wholesale banking. That is Mrs. Ella Chua. Then we also have Mr. Jin. That is the relationship manager for corporate banking, and also Mr. Simplice, relationship manager for corporate banking. I hope I've introduced them correctly. So at this time, I'm going to give it up to Mr. Terence, please, you can go ahead with the presentation. If you'd like to share your screen, please feel free to do that. Please, Bejo, can just allow sharing of the screen if it's not enabled. Mr. Terence, over to you. Okay. All right. So as we wait for him, we can continue the introduction. We also have Alice. You can introduce yourself, please.
Thank you, Dawin. My name is Alice Mutoni. I'm a medical student, 4th year at the University of Rwanda, and also I'm a country representative for Rwanda, AFAN Rwanda. I'm happy to be here. It has been a long time, and I'm excited for this meeting. Thank you.
Thank you, Alice. Then we have Master also. Okay, so what we're going to do is that we'll probably go ahead with the presentation for today, and then hopefully they'll join us with time. I think that's what we can do for now, right? So let me just start sharing the screen and then do the presentation.
Yeah, sorry for interruption.
Yes, please. Go ahead.
Yeah, so I'm sorry, during the introduction time, probably you mentioned me and then I was not around.
Oh, okay, you can introduce yourself.
Yeah, sorry for the interruption. So my name is Daniel Masunga. I'm a 4th year medical student from Tanzania. I'm coming from the Kilimanjaro Christian Medical University College. So I just saw the publication from the Twitter page. Then I got an interest to join the meeting. Yeah, so I'm so much interested to meet you guys. I hope I learn a lot from you.
Thank you so much, Daniel.
Thank you, Tom.
Okay, thank you very much. As I was saying, I am GF Terence, Relationship Officer in charge of developmental organizations for Access Bank Cameroon. My other colleagues that will be joining me in this call is Mrs. Chua Ella Martin, the head of wholesale banking, Mr. Jean Landry Binzuli, relationship manager corporate banking, and Mr. Wato Simplis, equally relationship manager corporate banking. Our purpose for this call was to introduce Access Bank Cameroon, Access Bank and its presentation and its presence in Cameroon, to get to know more of the activities of AFAN and see how we could get into mutual business relationship together. Going further to present Access Bank. Access Bank is the leading bank in Nigeria in terms of customer base, with over 50 million clients in Africa and over 600 branches found in more than 13 African countries, and equally in the United Arab Emirates and the United Kingdom, with representative offices in China, India, and Lebanon. Access Bank continues to lead the space in Africa in terms of banking, with its vision to be the world's most respected African bank, and its mission to set standards for sustainable business practices that will unleash the talents of our employees, deliver superior value to our customers, and provide innovative solutions for the markets and communities we serve. Access Bank, we decided to venture into Cameroon, Cameroon being the first subsidiary in Central Africa to benefit from the free trade in the Smart Corridor and Central Africa. We shall be going operational here in Cameroon on the 18th. We shall be opening our doors to the public on the 18th of April. But so far, we are meeting with developmental organizations to get to know their business activity, to see how we can bring a value-added solution to their activities and drive the objectives forward. Equally, we shall be opening another branch in Yaoundé before the end of this year, and we shall deploy our robot digital solutions to serve our clients far off within these two towns, and we shall work equally with agency banking to see how we can reach out to our clients. At the group level, we operate 4 business segments: corporate and institutional banking for large corporate, commercial banking for local corporate and developmental organizations, business banking, and retail banking for personal private banking. That is an overview of Access Bank and its presentation in Cameroon. Thank you.
Thank you so much, Terence, for this concise presentation of Access Bank. So at this point, I'll open to the audience or to the panelists to ask questions if you have any questions.
Thank you.
Anyone with
I'm
questions?
available for questions. Any.
Someone wants to ask a question? Okay. Is there anyone with a question? All right, so there's a question in the chat box saying, what are the aims of the bank?
All right. The aim of Access Bank is to provide banking solutions, be it to developmental organizations, to large corporate or multinational companies, and to retail banking. Provide financial solutions to all the sectors, right down to the low income earner. That is the objective of Access Bank. I don't know if I answered your question.
Has your question been answered? Okay. I have a question. What are some of the account types that you have that you offer, that someone, if I want to open an account with Access Bank, for example, what are some of the account types that are available at Access Bank?
All right, thank you, Dawin. We have individual accounts, be it savings account, be it current account. We have current account for associations, for multinational companies. So the account type depends on person and the activity. If it's an association or if it's an individual, but generally there are two types of accounts: savings account and current account for individuals and for association. The value added that we are bringing is based on our visit last week to Yaoundé, we realized that most developmental organizations here in Cameroon, they rely on external funding. And most often they are faced with the exchange rate fluctuation for dollars. Those who receive funding in dollars, in such a way, they are unable to forecast their budget back to a particular exchange rate. So the value added, given the fact that these developmental organizations, they rely on external funding and their activities are non-profit activities, what Access Bank is bringing as a value added is to propose foreign exchange forward in such a way that we shall agree with a definite exchange rate that will be applied on a yearly basis on all your foreign transactions that will be coming into the country to enable you to forecast your budget and carry on your activities smoothly. But this one is tied particularly for developmental organizations, for associations, that their aim is to assist the less privileged. I don't know if I answered your question, Dawin.
Yes, you have. Thank you. So I'll obviously reach out to you for more. There's another question in the chat box, but I'll try to read it a bit different. I will not mention the other banks that are mentioned in the question. Right. So is the bank feasible for students as compared to other banks, let's say in Cameroon? So what makes it more superior to the other banks that are already existing in Cameroon?
Thank you, Darwin. The bank, just as I mentioned at the beginning, that we have retail banking, in which retail banking englobes even student accounts, in which after now we are launching free account opening for students with a minimal deposit of 10,000 francs. The value added is that with the account, it permits you to have access to your account through a digital solution anywhere you find yourself.
Right. Thank you so much for
I
that.
don't know if I answered the question.
Yes, I guess you have answered. I think this should be the last question. So does the bank provide any sort of funding for organizations, especially the non-profit organizations?
Yes, Darwin, of course, as part of its corporate social responsibility, the bank does. And that is presently happening at the group level in Nigeria. And it is the same experience that we shall redeploy in Cameroon.
Okay. Maybe just as a follow-up question on the same. So what are some of the, I don't know if I can say qualifications for an organizations to access such type of funding?
Normally, we need to get into business relationship to understand your activities, for how long you have been operating. And one of the prerequisites is at least it must be a registered organization in the country where Access Bank finds itself. In this case, it is Cameroon. That is the first prerequisite. We can only assist organizations that are registered in the country. Your activities must be geared towards assisting the less privileged in all the sectors, be it education, be it health, be it youth empowerment. And the third is we must get into a business relationship, like a partnership relationship, not business relationship, a partnership relationship to be able to evaluate your activities, see where you're lagging, and see how we can come in. Another solutions that the bank always propose to developmental organizations is we carry out trainings on certain financial aspects for the management that are lagging in this particular sector. Equally, we can provide subsidies or funding with respect to the particular sector that we operate in.
Great.
Thank you.
This is nice. We'll reach out to you for any more information and any way we can partner with you as a bank. Thank you so much.
All right.
So for now, I'm sure you are free. If you want, you can continue. You can attend the presentation that we are about to have, or you are as well released. You are free to leave. That's fine with you. So thank you so much for joining us this evening. And like I said, we're going to reach out to you.
All right. Thank you very much, Dawin. I will share with the email the slide, the detailed presentation of Access Bank, so that each and everyone can have a detailed information about Access Bank. Thank you.
Sure, that's very fine. That will be okay. Thank you.
Thank you.
All right. Thank you so much, everyone, for being here. And we're going to go into the next segment of the presentation, which is the one to do with the clinical neuroanatomy series that we've been having the past 3-4 weeks now. So I'm going to do the presentation today, and I'm going to share my screen just now. All right, so I'm going to begin the presentation. My name is Dawin Sichimba. I'm a final year medical student at Copperbelt University School of Medicine in Zambia. And I'm the president of the Association of East African Neurosurgeons. So today I'm delighted to do this presentation on the Diencephalon that is under the clinical neuroanatomy series. So let's get into the presentation. So when we look at the diencephalon, we should understand that it is the division of the forebrain that is also called the proencephalon. Okay, and it is situated, rather it lies between the telencephalon and the midbrain. So I'm going to show the diagrams as we proceed. Then it also surrounds the third ventricle, and it is one of the vesicles that originate from the neurotube during embryology. So let's look at a bit of embryology before we go into much details. All right. So when you look at the diagrams that I've shared here, we can see that this is representing development in the third week of embryology. So from the neural plate, remember during development you have the trilaminar disc, isn't it? That is where you also have what is called the ectoderm. Okay. So from the ectoderm, that's where you get the neural plate, and then the neural plate develops into the neural tube. Now the neural tube is the one that is going to develop into the primary brain. Okay. Now what is this primary brain? The primary brain is divided into three parts. That is the proencephalon, mesencephalon, and the rhobencephalon. Okay. Now from these three, we have the first one, which is the proencephalon. It further subdivides into two parts, as well as the rhobencephalon also subdivides into two distinct parts. Now, my concentration in this presentation is going to be on the proencephalon, which develops into the telencephalon and the diencephalon, which is our main concentration for today. All right. So now, when you look at the telencephalon, it forms the cerebrum and the lateral ventricles. Then the diencephalon forms the midline structures. Okay. Now, so you can see from here you have the telencephalon and the diencephalon, which together come from the proencephalon, or rather the forebrain. Then the mesencephalon, this one it is the one that makes the midbrain, and then lastly we have the rhombocephalon, which forms the hindbrain. Okay. So now let's look at this is also another diagram, basically explaining what I'm just from talking about. So we have the neural tube here that is in the third week of development, then forming the primary brain vesicles, which are the proencephalon, the mesencephalon, and the rhombocephalon, which the first and the second, the proencephalon forms the telencephalon and the diencephalon, as in the secondary brain vesicles. Okay, then the rhombocephalon forms, or rather develops into the metencephalon and the myencephalon. Okay, now in the adult brain structures, what do these secondary brain vesicles form? Okay, so we can see that in the adult brain structures, you're going to see that the telencephalon is the one that forms the cerebral hemisphere, including the cortex, the white matter, and the basal nucleus. Then the diencephalon is the one that forms the thalamus, as we shall discuss later, the hypothalamus and the epithalamus. Now, in these, we can see that there are also these neural canals, okay, or rather the ventricles. So in the telencephalon, that's where you find the lateral ventricles, and then in the diencephalon, we're going to find the third ventricle, which is surrounded by the thalamus, as we shall discuss. Then the mesencephalon, which is the midbrain, forms the midbrain in the adult brain structures. It is going to form we're going to also have inside the midbrain, that's where you find the cerebral aqueduct. Then the metencephalon, that's where you find the brainstem, including the pons, as well as the cerebellum. Okay, now inside there, that's where you find the fourth ventricle. Then lastly, we also have an extension of this is simply the spinal cord, and inside there, the canal that you find is simply the central canal. Right. Now, let's look at the diencephalon. as we have discussed. Now, the diencephalon forms the it forms the, like I mentioned earlier, it forms the division, or it is part of the division of the forebrain, okay, which is the proencephalon. Now, it is situated between the diencephalon and the midbrain, so it makes that connection between the two. Okay, so let's look at. Let me just take you back to the previous slide again. So you can see that there's this connection. There's the telencephalon and the mesencephalon. So the diencephalon is the one that makes that connection between the telencephalon and the mesencephalon. Okay, so the diencephalon is divided by what is called the hypothalamic sulcus, which is denoted by this black line here. Okay, so you have this hypothalamic sulcus, and it divides the diencephalon into the dorsal and the ventral aspects of this diencephalon. Now, the dorsal aspect, it consists of the thalamus, okay, the thalamus and the epithalamus. Okay, now the epithalamus, when you look at the epithalamus, it consists of number one, you have the anterior and posterior paraventricular nuclei. Okay, then you also have the medial and the lateral nuclei, and so on. As we shall look at all these as we proceed. Then we also have the ventral part of the diencephalon, which consists of the subthalamus and the hypothalamus. So we can see from this diagram here, you have the dorsal and the ventral. So in the ventral, that's where, then from there, we also have that connection where you have the midbrain and also the cerebral aqueduct. So you can see that this part, this aspect here, where the diencephalon is, this is basically the what? That is the that is part of the proencephalon. Then we have the midbrain. Okay, so this is the forebrain, and then we have the midbrain. All right, and then we have the hindbrain, where the inside the midbrain. That's why you also find the cerebral aqueduct. Okay, so this is also another diagram simply representing what I'm just from explaining. So you can see that you have all these other structures. You have the corpus callosum, you have the cingulate gyrus here, and so on. And then now remember especially when you look at the cerebrum, you have the left and the right cerebral hemisphere. Now the two are held together by what are called commissures, which we have the anterior and the posterior commissure. Okay, then just posterior to the posterior commissure, you have the pineal gland, and then you also have the thalamus right here. Okay, and then you have the hypothalamus, which forms the floor of the diencephalon. Okay, then just inferior ventral to the hypothalamus, you also have the optic chiasma. Actually, the optic chiasma is also part of the hypothalamus, as we shall discuss later on. Okay. Now, of course, from the hypothalamus, you have that connection, okay, with the pituitary gland. Again, this is another diagram explaining what I'm just talking about. So you have the interventricular foramen here, okay, and then you also have the thalamus, okay. So this is the thalamus, and then you have the hypothalamus here, and the pituitary there, and so on, okay. Then this is the epithalamus, okay. We have the epithalamus there, where you, here, and then you have the choroid plexus right here, okay, where of course production of CSF occurs. Then right there you also have the third ventricle. Then from the third ventricle you can see that you're going to have this cerebral aqueduct. Okay, so this is just a cadaveric section, which is the middle perspective of the partially dissected brainstem. Okay, the diencephalon and the cerebellum. Okay, so this is the corpus callosum, as you can see. Okay, and then you have the optic chiasma somewhere here. Then this is the anterior commissure, and then you have the posterior commissure here. Okay, so right here is where you find the thalamus, and somewhere here, that's where you find the hypothalamus. Okay, then of course here, that's why you're going to find the third ventricles and so on. Okay, and then you also have the cerebellum and so on. Okay, so when you look at the MRI, this is what you're going to see. All right, so I'm going to see the pituitary gland here. Okay, then and the optic chiasma there. So somewhere here, that's where you're going to find the hypothalamus, and then the thalamus is going to be here, the epithalamus somewhere around here. Okay, and then you also have the phonics, which is part of the epithalamus, as we shall discuss later on. And then you also have the fourth ventricle and so on. Okay, this is also just what I've from explained. So you have the thalamus there, the midbrain, the pons, the corpus callosum, okay, and so on. Okay, so let's look at the thalamus in a bit more details as we continue the discussion. I hope everyone is able to hear me. Can you hear me? Can everyone hear me?
Yeah, we can.
Okay, thank you. Thank you for that feedback. Okay, so let's look at the thalamus. Now, when you look at the thalamus, it is a large paired and ovoid mass of nuclei located in the diencephalon, as we have already discussed, and it forms the upper third of the lateral wall of the third ventricle. So, I hope I have a diagram. I think, in the subsequent slides. So this thalamus, it actually makes two thirds. It creates two thirds of the lateral walls of the third ventricles. Now, it also has 5 relations. There are 5 relations. That is the rostral relation, the ventral, the posterior, the medial, and the lateral. Now, what is found in the rostral aspect of this thalamus? So this is where you're going to find what is called the interventricular foramen. Okay, so this part, this is the rostral relation of, it forms the rostral relation of the thalamus. Then you also have the ventral relation. So ventrally, you're going to find the hypothalamic sulcus. Okay, so remember we talked about the hypothalamic sulcus being what divides the diencephalon into the dorsal and the ventral. Okay, so in the ventral aspect of the thalamus, so superior to this hypothalamic sulcus, that's where you have the thalamus itself, and then posterior, inferiorly there, that's why you're going to have the hypothalamus. Okay, so the ventral aspect of the thalamus is formed by the by the hypothalamic sulcus. Then posteriorly, you're going to find the posterior commissure. Okay, so the posterior commissure is here, and of course you have the anterior commissure somewhere here. So remember what I mentioned earlier, that the two commissures, they're more like hold the two hemispheres together. Okay, and we're going to discuss especially the posterior commissure as we proceed. Then medially, you're going to find the third ventricle. Now, remember I mentioned that the thalamus is actually paired. Okay, so it's more like on either side of the third ventricle. Okay, so the third ventricle passes through the thalamus. Okay, so on either side of the thalamus, that's why you're finding the lateral walls of the third ventricle. just like I've mentioned here, we said that it forms, the thalamus actually forms the upper two thirds of the lateral wall of the third ventricle. So laterally, the lateral aspect of the thalamus, that's what I find in there, the walls of the third ventricle. Okay. Then laterally, also that's where you're going to find the posterior limb of the internal capsule. Okay. So I'm going to show you in the subsequent slides where you can see the internal capsule. Okay. So this is the internal capsule here. Okay, you have the internal capsule there, and then you have this is right here. That's where you're finding the thalamus. Okay, then somewhere here, that's where you're finding the what that's where you're finding the hypothalamic sulcus, which is here. Okay, if you look at it from on the diagram on the right side of the slide, so this is the hypothalamic sulcus. Okay. Then here you have the interventricular foramen, and then just down there, that's where you have the midbrain joining and starting from there. And then you have the cerebral aqueduct there. Okay. Now, so what we're saying is that ventrally, okay, in the retro aspect of it, that's where I find in there the interventricular foramen. Okay, then ventrally, that's where you're finding this sulcus here. Okay, which is the hypothalamic sulcus. Then posterior to it, that's where you're going to find the posterior commission, which is can't see it from here, but it's somewhere around here. Okay, then medially, that's where you're finding the third ventricle. If you look at it from on the diagram on the left, so on the medial aspect, that's where you have been the third ventricle. So it forms the upper two thirds of the lateral walls of the third ventricle. Then laterally, that's where I'm also finding the posterior limb of the internal capsule. So this is the internal capsule here. You find the internal capsule somewhere there. So this is the posterior limb of the internal capsule here. Okay, so this is again just the same diagram that I had in the previous slide. Now I want us to look at the surfaces and the ends that we have. So the thalamus actually has 4 surfaces and 2 ends, right? So what are the surfaces? The surfaces that we have the medial surface, we have the superior surface, the lateral surface, and the inferior surface. Then the ends that we have, you have the anterior end and the posterior end. Now, let's look at a bit more details about these surfaces. Okay, so the superior surface of the thalamus is covered, which is right here. Okay, it is covered by thin layer of white matter, which is called stratum zona. Okay, so right there, when you look at the superior aspect of the thalamus, you're finding this. You can see that it looks like it is white matter. Literally, it is white matter. Okay, so this is called the stratum zona. Then it is also bounded. It is bounded laterally. Okay, by the coated nucleus. So laterally around this side, it is bounded by the coated nucleus, and then you also have the what is called the thalamus striate vein. Okay, so the thalamus striate vein is found somewhere around here. I hope I have a clear diagram that is showing the thalamus striate vein, and a nerve fiber, okay, bundle which is called the stria terminalis. So this is the lateral aspect. Then the lateral part also lies in the floor of the lateral ventricle and is covered by ependyma. So remember, these are the lateral ventricles, isn't it? So you have the lateral ventricles there. So the lateral part is also bounded by the lateral aspects of the inferior aspects of the lateral ventricles, the floor of the lateral ventricles. So on either side, because you have two parts. You have the right side and the left side. So you can see that you're having the flow of the lateral ventricles binding this superior aspect of the thalamus. Then let's look at the ends that we have. So remember, I mentioned that you have the two ends, posterior end, the anterior end, and the posterior end. Is it okay? I can hear some noises. Okay, so I've talked about the superior surface of the thalamus. Let's look at the medial surface. Okay, so the medial surface, which is right here. Okay, so the medial surface of this thalamus, like I've already mentioned, it forms the upper two-thirds of the lateral wall of the ventricles, and it connects the medial surface of the other thalamus on the opposite side. So you can see that as you go up, okay, it forms that sort of connection here. Okay, so you have the two major surfaces of the two parts of the thalamus. They form some connection right there. Okay, and then it is also covered by ependyma. Okay, it is also covered by ependyma. Then let me talk about the lateral surface and the inferior surface. So the lateral surface is covered by a layer of white matter, which is called the external medullary lamina. I'm going to discuss it as we proceed. Okay, so the external medullary lamina, okay, is found right here, somewhere here. Okay, so in the lateral aspect of the thalamus. Then it is also related to the posterior limb of the internal capsule, as we already mentioned. Then the inferior surface, which is the ventral surface, it is continuous with the tegmentum of the midbrain. Okay, so when you look at the midbrain, remember from the previous slide, it showed very well where the midbrain starts from. So it is this part is the one which is continuous with the midbrain. Okay, so let's look at the thalamic nuclear. Now I'm going to try and as much as possible to summarize this and so that I don't take too long on this. So when you look at the thalamus, it is composed of gray matter, okay, which is interrupted by two vertical sheets of white matter called medullary lamina. Okay, so this diagram on the left side of the screen, okay, it is a simplified way of trying to represent this, right? So you have these vertical sheets. So you have the external one, all right? So you have this one, which is called the external medullary lamina, and then you also have the internal medullary lamina. Okay. Now the internal medullary lamina, it forms a Y shape like that. It forms that Y shape, such that you're going to divide this thalamus into three portions. That is the anterior, the medial, and the lateral aspects of parts. They have a number of nuclei in them, as you can see on the right side of the diagram here. So you have all these. You have the lateral dorsal nucleus, you have the lateral posterior nucleus, the ventral anterior nucleus, you have the ventral lateral nucleus, the ventral posterior nucleus, the ventral intermediate nucleus, the ventral intermediate nucleus, the ventral posterior medial nucleus, and then you also have the ventral posterior lateral nucleus. So you have all these nucleus. Basically, they are found in these different portions of the thalamus, that is the lateral nuclei. So it's like you get this division of the thalamus, that is the anterior nuclei, and then you also have the lateral nuclei and the medial nuclei. So in each of these, you have a number of nuclei that are contained in there. Now, I'll not go into details of this. So you can see there's the Y shape, and then it is dividing those into different regions. So again here, this diagram here is showing how these different nuclei that are found in the thalamus are related to the cerebrum. Okay, so you can see that for example, the ventral anterior. Okay, the ventral anterior there, you can see the relations, how it is related with the cerebrum. So you're going to find that the different parts, the different nuclei that are found in the thalamus are related, or rather they coordinate different functions in different regions of the cerebrum. Okay, so let's look at the blood supply to the thalamus. Unfortunately, I didn't add a diagram showing these blood vessels. So the thalamus is supplied by two sets of arteries that are derived from the posterior cerebral artery. So when you look at the circle of Willis, you're going to find the posterior cerebral artery. Okay. So number one, you have what is called the thalamoperforating arteries, which supply the anterior and the medial aspects of the thalamus. So if you remember from the previous slide, you had the medullary lamina, okay, the internal medullary lamina, which makes that division. You're having the anterior, the medial, and the external. Okay, so the thalamoperforating arteries supply the anterior and the medial aspects of the thalamus. Then the thalamo-geniculate arteries supply the lateral and the posterior parts of the thalamus. So venous drainage of the thalamus is done by the thalamic veins, okay, which join the thalamus striate vein. So remember, I think I earlier talked about the thalamus striate vein when I was talking about the superior relations of the thalamus. Then the thalamus striate vein, which is within the choroidal vein. Okay, I mean together with the choroidal vein, form the internal cerebral vein. So as we almost finish up on the thalamus, what are the functions of the thalamus? So in brief, the functions of the thalamus is basically integration of sensory and motor systems. Okay, so if you remember, I was talking about the different nuclei of the thalamus and how they are related with the different parts of the cerebrum. Okay, so those parts of the cerebrum are found in the sensory aspects, the sensory systems, and the motor system. So that's how come this thalamus is directly related. The different nuclei of the thalamus are directly related with different parts of the cerebrum, so that it integrates the sensory and the motor systems. Then it also receives precortical sensory input from all sensory systems except one, which is the olfactory system. Then it is also the center for visual and the auditory reflexes, and it is also the center for, or rather the taste pathways also pass through the thalamus. Okay, so let's look at the clinical application of the thalamus when you're talking about the thalamus. So you're going to find that the lesions that affect the cerebrovascular lesions that affect this thalamus, okay, they actually you can have the cerebrovascular lesions and also tumors. Okay, now they are going to lead to loss of sensation in the contralateral side of the face and the body, okay, followed by distressing discomfort and burning and diffuse pain in the anesthetic areas. Okay, so how are you able, when you take a detailed history and your examination, you'll be able to know that what the patient is actually presenting with is actually due to thalamo lesion, which could be a cerebrovascular lesion and also a tumor. Okay, now we should understand that lesions of the thalamus do not usually occur alone. They occur together with other lesions of the cerebrum. Then you also have what is called thalamic hand. Okay, so when you look at the thalamic hand, you're going to find that the contralateral hand is held, if it is held in the abnormal posture in some patients and with these thalamic lesions. So if a patient has a thalamic lesion, which can be a tumor or cerebrovascular lesion, you're going to find that this hand, the contralateral hand, is going to be held in the abnormal position. The wrist is going to be pronated and flexed. Then the metacarpal phalangeal joints are also going to be flexed, and the interphalangeal the interphalangeal joints are also going to be extended. So you can see the wrist is flexed, the metacarpal phalangeal joints are flexed. Then when you look at the interphalangeal joints, they are actually extended. So this is what is called the thalamic hand. Okay, so the fingers can also move. Okay, can be moved actively, but these movements are quite slow. So patients will be able to move the fingers, but these kind of movements that are able to make, they're actually slow compared to the normal. Okay, so the condition is due to altered muscle tone in the different muscle groups of the hand due to these lesions, which can be cerebrovascular or the tumors. So because of that, you're going to find that altered muscle tone in those muscle groups. Okay, so let's look at the hypothalamus. So when you look at the hypothalamus, okay, number one, what we should know is that it makes up the flow of the. So we've already talked about. Remember, there was that division. Okay, we looked at the thalamic hypothalamic sulcus. So there's that division, and then you have the hypothalamus right in the floor there. Okay. So the hypothalamus is the part of the diencephalon that forms the floor. Okay, and the lower part of the lateral wall of the third ventricle. So when you look at the third ventricle, again, remember I said that the upper two thirds is formed by the thalamus. Now the lower part of the lateral wall of the third ventricle is formed by the hypothalamus. Okay, so it actually extends. I'll show you from the subsequent diagrams. It actually extends from the region of the optic chiasma to the caudal border of the mammillary bodies. Okay. Now, what are the basic functions of the hypothalamus? The basic functions of the hypothalamus is basically autonomic control. So it works together with the autonomic nervous system. It works together with the endocrine system and also the limbic system. So it maintains the internal environment by coordinating with these other systems, that is the autonomic, the endocrine, and the limbic system. Then it also has relations. Okay, so the superior relation of the hypothalamus, obviously we have the thalamus itself, the inferior aspect, we have the midbrain, and then the lateral aspect, we have the internal capsule. Okay, so remember the internal capsule on the lateral aspect is also forms is also related to the lateral aspect of the thalamus. Then we also have what are called zones. Okay, So the thalamus as the medial and lateral zones. Of course, I'll not go into details of that. Okay. Then, okay. So this is also just another diagram that is depicting what we are just from talking about. So remember, what we're saying is that we also have these structures. There's some of these structures that make up the hypothalamus. Okay. Now, some of these structures in brief, we have the optic chiasma, we have the infundibulum, we also have the tuber ciliarium and the mammillary bodies. Okay, so we have the mammillary body right here, and then you also have the optic chiasma, which is somewhere here. Okay, and then you have the infundibulum, and then you also have the tuber ciliarium. Okay, again, this is another diagram basically talking about the same what I'm just talking about. Okay. Okay, so what are the functions of the hypothalamus? The functions of the hypothalamus, number one, thirst and water balance. Okay. Other than that, you also have production of releasing factors. Remember, the hypothalamus is involved, or rather influences the function of the pituitary gland, isn't it? So it releases those hormones that influence the function of the pituitary gland. Then also precursors of antidiuretic hormone and oxytocin are actually produced within the hypothalamus. Then it is also the hunger center also involved in autonomic regulation and also in temperature regulation. Then let's look at the subthalamus, and last we shall talk about the epithalamus. We're almost done. So the caudal part of the thalamus contains the subthalamic nucleus. Okay, so you can see the subthalamus is right here. So you have the thalamus, which is found here. Okay, and then you have the hypothalamus there, and then the caudal aspect of the thalamus. That's where you find the subthalamus, and this is found actually on the posterior aspect of the hypothalamus. So then you also have cranial to it, you are going to have the red nucleus, and then the cranial part of, and also the cranial part of the substantial nigra, which is part of the basal ganglia and the reticular activating system of the brain. Okay, so the epithalamus, that's where we find the phonics. Okay, I think I should have a diagram which is showing phonics properly. Okay. Okay, so you have the phonics. Okay, you have the phonics there, and then you also have what is called the habenular nuclear and the commissures. Okay, so remember I already talked about the commissures, which is the anterior and the posterior, and then you also have the pineal gland. Okay, the pineal gland is found somewhere here, and then you also have the posterior commissure, which is also found just posterior to the epithalamus. Okay. Now, the posterior commissure is actually concerned with bilateral papillary reflex. Now, let's talk about the lesions of the diencephalon. Okay. So lesions of the diencephalon are going to lead to, number one, you're going to have poor temperature control. You're also going to have abnormal appetite. You're also going to have lack of antidiuretic hormone, which is going to lead to polyuria and polydipsia. Then because of this, you can also, these we should understand that, like I mentioned earlier, they rarely occur alone, but they occur together with other cerebral lesions. Okay, so this is the end of my presentation. Thank you very much. If there are any questions, please, you may feel free to ask.
Okay, this is Elvis. I'm a medical student and a clinical officer from Kenya. So these are very detailed presentation. Thank you. So in case of the lesions which are affecting the thalamus, is there any recorded neuroplasticity changes in the contralateral thalamus in relation to the cerebral presentation.
Sorry, come again.
I'm asking, in case of the lesions which are affecting the thalamus, is there any neuroplasticity which is happening to the contralateral thalamus? And is there any relation to the cortical representation of the thalamic nuclear?
Okay, so in the case of it all depends on the extent of the lesion. Okay, remember, in the case of cerebrovascular lesions, right? If these cerebrovascular lesions are involving a larger portion of the thalamus, yes, it's possible. Again, when you look at the tumors, tumors can actually be tumors of the thalamus itself, or tumors that are in the adjacent structures that are near the thalamus. And then they're going to be causing compression on the thalamus. So in that case, again, depending on the size of the tumor and the amount of pressure that is being exerted on the thalamus, it's also possible to have that.
Okay, thank you, Dawin. Could you also share the slides in the Telegram?
Yes, sure. We're going to share that.
Okay, thank you.
You're welcome.
Hello, Dawin.
Hello.
Yeah, Dawin, thank you very much for your outstanding presentation. I just have just a question. Yeah, given the role of the thalamus and also the implication when there's a possible lesion. Now, is it possible that, because I think the thalamus is on both sides of the brain, is it possible that, let's say, if a patient has a lesion in such a way that that person will need one of the hemispheres being taken off? Is it possible that like the remaining thalamus will actually perform the same function effectively as the other one? Or is it that maybe in case you are supposed to do that, you want to spare the other thalamus, just removing maybe the cortex and the other parts of the brain?
Okay, so I may not be able to give an exact answer, but looking at it from the structure, remember, when you look at the structure of the thalamus, right? It's actually one. Okay? Actually one. But then through the thalamus, it passes. It's like you have the left side and the right side, isn't it? And then they are connected. Okay, they are connected by what the intra that connects the left side and the right side. So the left side is the one that is involved. Then the right side can still work. Or if they remove, let's say you remove the left side and then you only remain with the right side, like I mentioned earlier, depending on the extent of the lesion of the contralateral side, yes, the other side of the thalamus is actually going to work. Remember I was saying that these lesions of the thalamus affect the contralateral side of the body, meaning that if the left side of the thalamus is involved, then the clinical manifestations are going to be seen on the right side of the body. So it's possible. It's somehow as if they are working independently, but they're actually one. So it's possible that you can have involvement of both, or you can have involvement of only one side of the thalamus.
Thank you very much, Dawin. Thank you very much.
You're welcome. Any other question? Okay, if there are no any further questions, I'm going to end my presentation here. Thank you so much for your attention, and it's a pleasure to see all of you here.